My name is Amber, and I survived toxic shock syndrome.
And that's on period, sis. And we're back at it again with yet another episode of the Period Sis podcast. I am your host, Mandy B. And listen, today, baby, today we are literally talking about an urban myth, or so we thought. No, I'm not talking about a chupacabra, okay? Not talking about Bigfoot. Not talking about the tooth fairy. I am talking today with our guest about toxic shock syndrome.
And so just for everyone at home, toxic shock syndrome is a rare but life-threatening condition that's triggered by certain types of bacteria. What happens with toxic shock syndrome is your body will have bacteria, and that bacteria will start to make toxins. When that gets into your blood, it can cause symptoms like low blood pressure, high fever, vomiting, diarrhea, also a sunburn-like rash, particularly on the palms and the soles. Now, a retained tampon is one potential reason for toxic shock syndrome. However, I know a lot of people will associate the toxic shock syndrome with tampons only, but it can actually happen in women and men, and it can happen for other reasons, such as burns or cuts after a surgery, after a viral illness like the flu or something like that. So it's not just in women, and it's not just with tampons. Also, I don't want everyone to be afraid of tampons. Remember that it's super rare. And also, since the 1980s, we've changed the way we make tampons to drastically decrease the incidence of toxic shock syndrome. Now, what she did was she went to the emergency room to get help, and that is what is key. You really want to get treatment as soon as possible to have the best outcome possible.
Y'all, I found somebody that had it. Can you believe this? Okay. Well, today we are joined by Amber, who is a 25-year-old from Jersey, to share with us her experience. Hello.
Hi.
Okay, now literally, and I told you when you walked in here, you put it in the subject line, toxic shock syndrome. And I was like, whoa, someone has had it. I know that we've literally kind of heard about it. And even in your email from middle school, we know that you can't keep a tampon in you forever or you gonna die. Mm-hmm. That's literally kind of how they,
like Mean Girls.
That's exactly how we learned it. And so before we get to your actual experience, right? I want to know let's go all the way back. Toxic shock syndrome is definitely something that deals with our periods, with our menstrual cycle. Mm-hmm. Let's get into how we get there later, but let's start with you starting your period and your experience with tampons to begin with. Talk to me.
So I did gymnastics competitively, and when you do gymnastics competitively, a lot of people get their periods later, and my mom had gotten her period later too. So,
what is later?
Like 14. She got hers at 14.
Okay.
So I was like, I'm not gonna get mine till 14, and I'm doing like 4 to 6 hours of a sport every day, or like 4 times a week. So I was like, I'm great. 12 years old, the end of my 7th grade year, I get my period. And I don't know if Always still does, I don't know. The brand.
Go ahead and talk about it.
I don't know if Always still does this, but before I got my period, they would send like boxes, I guess, in preparation for like girls that were in like 11 to 12 to get their period. So I had seen
They send boxes where?
Like to my house. Like they would send like just like, and it would be like, hey, preteen, like whatever. And I would, so I could see them and see like how to use. But I didn't have a period, so it was really dry. It wasn't like anything. So I was just like, whatever. I got my period, told my mom, and it was right during gymnastics season. So I was wearing pads to bed, like the ones, the big, heavy, the diaper ones.
Yep.
But for meets and for practice, I had to wear a tampon just because, well,
what is the, I guess, gymnastics culture? Girl, I ain't never been no gymnast, okay? I played basketball. We could wear pads playing basketball. It wasn't, we didn't need the Tampax sport or anything like that. But you're in leotards. Is it that there is a stigma even with little girls about pads and about having their menstrual cycles?
I think I was probably the first person on my club team that had got it.
Oh,
so
wow.
It wasn't even like like the older high school girls, obviously, but like the 13, 12, 14-year-olds, no one had it. Wow. And you wear like a liner, but a tampon, because in competition, in anything out, like you can't have tattoos, you can't have.
Well, I would hope not at 12 years old.
But like in high school, like it's very, very strict. So it has to be clean. You have to be cut. Like nothing can come out. Even if like your underwear comes out, you can't. So I was wearing like thongs at 13, 14, because I had to, or I would just not wear underwear. Like you had to have everything together. So I guess when I like told my coach about it and everything, like that was just what it was. So my mom had never wore tampons before because
ever in her life.
No, like
wow.
Yeah, and she, at her big age, and so when we first did it, we were just like figuring it out together. She was like reading the box, I'm in the bathroom like trying to figure it out, and that's where I started.
I will say that's also one of like the nicer like tales of womanhood where you and your mom are literally trying to figure out how to wear and use tampons together. I love that she was like, girl, if you gonna do it, I'm gonna do it too. So you start wearing tampons as early as 12 years old.
Yeah.
Clearly, you know what you're doing
Yeah.
throughout high school, throughout college. Let's get to college. Let's get to where this incident kind of arose, because a decade later, something kind of took place. So let's get into college.
So it was my sophomore year of college. It's midterm season, and it's like April-ish, end of March. And I was just stressed, like, and I think you just equivalent to stress because you're like, I'm in college, like it's new surroundings and everything. But for me, I was really, had no energy, had no appetite. I'm already petite, so like not eating is like bad. And then even like I would drink water, I would still be dehydrated. I would have like colds and they wouldn't really go away.
So these are all just symptoms you felt kind of out of nowhere?
Yeah.
Okay.
Yeah. And my period was pretty like normal, like 28, 29 days. So I knew like it was the 12th of the month. Every month, on the 12th of the month, I knew that it was coming. And so I had, like, it was probably just a regular period. I put it up and I put the tampon in. And of course, the string hangs out. So, you're going to pull out the string, put the other one in. I had to be like every 4 hours because my flow was heavy.
Okay. I don't want to skip.
Okay.
So you have these symptoms.
Okay.
And again, you're in college.
Yeah.
You're kind of blaming it about your environment, the stress of that. You're like, I'm kind of all right.
Yeah.
At what point do you say, I need to go to the doctor? Maybe I'm not okay. Because again, you can't eat. You're drinking water, but you're still dehydrated. You are lethargic.
Yeah.
You can't sleep.
Yeah.
So you have these symptoms for how long?
That was about a week. But the preempting, when I went back and realized, then I'll go when we get to that part. But when I went back and realized I had put one up, and the reason why I didn't see the string is I had put another one underneath, like in, which I didn't even know was a thing that could happen.
Okay, so you have your cycle. Your cycle ends, but you just feel all of these symptoms.
Yeah.
You choose first to go to urgent care.
Yeah, because I am 19, so I could still go to my pediatrician, but I was in the process of finding like my primary care physician.
Okay.
So I went to urgent care. Urgent care was a male doctor, and he was like, yeah, like, you're just in school. You're tired. Like, take some Tylenol, take a nap. Like, you'll be fine. And I was like, oh, okay. And I didn't even, again, because who talks about toxic shock? Like, who?
Right.
That's not even, that wasn't even on my mind. So I was just like, oh, like, he's a doctor, so.
So you go home, you take the Tylenol.
Yeah.
You try to get some sleep.
Nothing happens.
How long until you go to your second doctor's visit?
So then it's about another week, and I just went to my pediatrician because I was like, it has to be, and maybe because they have like my full chart, they could see all the things. And my pediatrician, because they're not a gynecologist, so they're just looking at all the outside symptoms. And they agree with the urgent care doctor, but they said, because you're 19 and you haven't gone to a gynecologist yet, here's a referral for a gynecologist. So that was the difference between the two. But it was, but they couldn't do anything internal because they're just a pediatrician.
For both of these visits, so you go to an urgent care, then you go to a pediatrician.
Yeah.
Did they run any tests? Did they take your temperature? Did they, I don't know, say, are you pregnant? Did they give you an ultrasound? Was there anything that they thought to go to outside of just telling you, well, you 19 and you stressed because you in college? Like, was there any other things that they thought it could have been?
No, I think they thought that it might have been gynecological, like the pediatrician, just because it was nothing that they could see. They took my temperature,
Okay.
but there was no test they could see. The pediatrician doesn't have ultrasound, so it was just, and urgent care, I think they're just so used to like people like that don't have insurance, or people that are just trying to like get over or whatever.
Or the fact that you're a Black woman and they say that
And this too.
y'all complain about everything. You're not in as much pain as you say you are.
Yeah.
Okay, so then you get your referral to the gynecologist.
Yeah.
Now, was there any conversations before going to the gynecologist, knowing that this was your first time? Did you have a conversation with your mom at all? What to expect?
So I talked to, so I knew I was gonna get a pap smear, and she was like, it's gonna be painful, and like, it's gonna be painful.
Okay.
And I was like, okay. Like, I had tattoos at that point, so I was like, I have a
You
high.
like, girl.
So like, whatever.
Girl,
Like, it's fine.
I done had needles to my arm.
Exactly. It was painful. It was,
Your first pap smear was painful.
It was more painful than I thought it was going to be. It wasn't like unbearable, but it was like more painful than I thought it was gonna be.
Okay, so your mom scares you shitless.
Yeah.
Before going to your first gynecologist appointment.
And she came with me, so it was, it was
well, that's good.
Support.
Y'all done learned tampons together and your first gynecologist visit. I love it. So you get to the gynecologist.
Mm-hmm.
You tell them you've been having these symptoms now for almost 2 weeks.
Yeah.
You've gone to urgent care. You've gone to a pediatrician. What is the conversation with them? What do they assume, or do they go straight in to give you a pap smear?
So because the age that I was, they were like, well, we'll just like take a look. Like, let's see what's going down in there. And immediately when I got into the stirrups, he was like, there's a smell. And I was
Okay. So you didn't smell nothing.
No.
At the time, did you have a partner?
Did I? Yes, I did.
And they didn't say they smelled
No.
anything. We'll talk about maybe after, if maybe they was just being nice to you. Because at 19, because let's be very clear.
That's true.
At 19, I think, let's be, in your 30s, there's still this shame or conversation where you kind of don't tell your partner if something smell a little off.
Yeah.
Because also, you want to believe that they're educated enough to know that, well, during your cycle, things
Could be
change.
different. Yeah,
Things could be different. Maybe, So, okay, so you have a partner, but they didn't smell anything. But as soon as the gynecologist goes down, they're like, there's a smell.
Yeah. Like that, like copper, metallic, when you're on your period.
Okay.
Like that, like smell, but like a lot.
Okay.
Because at that point, I wasn't on my period anymore. So it was dried blood and
Right.
dried all the things else that come out when you have your period. And then they pulled it out, and I was just like, oh, that's like.
Now you were like, oh.
Like, that's what that was. And I was like, oh. And he was like, yeah, like if you, like my symptoms were pretty severe, but and I've seen stories of other people that have kept it in longer. And he was like, you could have ended up in the hospital. Like you could have died from that. And
So, and just because I want to list again.
Yeah.
Your symptoms that you felt over 2 weeks were again.
lethargy, so I had no energy. Like I'm a more stressed life, but like still like I'm not sleeping for real. I'm not eating for real. I'm drinking water, I'm still like feeling dehydrated. Like my mood is low too. Like everything is just like, I feel like drained, and there's nothing that I can do to support outside of like take Tylenol. And that's not helpful, you know?
The way everybody just want to just take a ibuprofen.
And I don't even, I don't even like taking medicine like that. So I was just like, what's going on? Like
Right.
at that point, the point that like I had to go to the doctor, like, and I don't like going to the doctor, like it was serious for me. And then for the first doctor to just be like, it's nothing. And the second doctor have a little bit more urgency, but still.
It still might not be nothing.
Yeah.
So what is that like? Are your legs propped open?
Yeah.
Give us the scene.
You're in
okay.
like
You're in the chair. Do they have the thing to open up your? How did he pull it out? Was there tongs? Did he reach his hand in there? I need to know. And where did he say it was? How did it not fall out? Were these questions that you asked? But set the scene on him saying, there's a smell in there.
Because I think that he thought that I had something like a STD or something. And I think that's what the thought process was. And then when he realized what it was, and I explained to him, he said, yeah, like that can happen. Because I was using the super size. So I had the other one in. I don't know to this day, I don't know how I didn't see the string from the first tampon come out. But the second tampon pushed it up so far into my cavity, I guess like the uterine cavity, and to the point where like I didn't see it anymore. Like I couldn't have gotten it out.
So
even if at home.
Because your flow is so heavy.
Yeah.
I know you said you normally change your tampons every 4 hours.
Yeah.
Have you just had the experience where it got so heavy that it fell out and you assumed that it fell out in a toilet? Or,
yeah.
And I was also going to say depending on where you live, there are also tampons that don't have the strings. Or like, you gotta push it up in you.
Scary.
It's like
like the one with
the OBO brand.
Yeah.
And
I couldn't use those. I used those for like a week and then I was like, no.
Yeah, what is it? Well, they're also, a lot of them are not really super either. They're like for regular or light flows. So you just think it fell out. So you're like, I'm just gonna push another one in there.
Yep.
And so,
I didn't feel anything either. Like it wasn't any discomfort or anything. So he had to pull it out in order to do the pap smear because it was that involved in everything else that was in there.
What information did he give you about toxic shock or about this experience that you've kind of kept with yourself?
It's something that affects your immune system. So anything else that so if you get a cold, now you're dying. It's something that your immune system is heightened, so you're not able to live your normal life in the way that you want to, and it causes all those other symptoms because your blood cells aren't fighting for you, basically.
Oh, wow.
Yeah. So the other conversation that we had, because my flow was really heavy, I was having like super heavy cramps and everything. So we had talked about birth control because he was like something to make your cycle a little bit regular, to make your mood. But obviously for me, I can't do anything where I have to remember stuff. Like I was like, I can't take the pill because I'm gonna forget. I'm gonna get pregnant. Like it's not.
I ain't gonna hold you, but also you saying that there's so many things where how we just laughed about Tylenol and ibuprofen. For women, it's, well, let's just put you on birth control.
Yeah.
Like, there's so many times a doctor literally suggests birth control.
Yeah.
When it's like, well, of course you had cramps. You had a whole tampon stuck in you for 12 days. I don't know if we have to immediately jump into putting me on birth control because I had heavy cramps. Of course I did. My flow is heavy, but maybe there's something else. I just hate the immediate, let's throw you on birth control because it does affect your hormones and everything.
The only reason why I was more on his side too, because before even like the tampon thing, but I just thought that was normal. And it was right when Trump became president. And so I wasn't sure if we were going to have the same reproductive rights and laws that we were going to have. So I was like, if I'm going to get something, let me get it now while it's free and it's accessible. And I live in Jersey, so it's not like a crazy state where something could happen, but it could have. So I was like, let me just, while I can get it, let me get it and be good.
So I didn't really consider the age difference. Growing up, and I was in Florida, girl. Yeah. But growing up, girl, that was like the Bush era.
Yeah. Oh.
The brother.
Oh.
But for us, a lot of my friends, once we were in high school, again, as soon as you even start thinking you want to see a dick, they're like, let's just put you on birth control, right? And so outside of the fears of sex and pregnancy, again, when you go in and say you have cramps or heavy flows, they want to put you on birth control. I don't think I ever considered that today in age, with the reversal of Roe v. Wade and reproductive rights being in question, that's where your mind went. You are like, Trump is in office. This is what I need to do at my age. What are those conversations like then? Like with you around that?
It was a lot. And me and my friends were having a lot of those real conversations. And unfortunately, I have sex with men. So that's what I had to do. But a lot of my friends.
Not unfortunately. While your man is right over there.
But so I have to think, like, most of my friends are queer and only have sex with women or mainly have sex with women. So, like, it's not something that was at the front of mind where I was like, this might be something that I have to really think about and deal with. So that was it was a big part of the decision, but it was so I ended up getting an IUD and best decision of my life. Best decision of my life. Now I had a period for about 3 months after I got it. I don't get a period now. I don't have to worry about tampons.
And they were heavy and painful for you.
Exactly.
I love that you brought up that you and your friends have these discussions. Because you say that you ended up bringing up your toxic shock syndrome and that whole experience with your friends.
Yeah.
And again, they said chupacabra who?
Yeah, like
they said
because we
Bigfoot
hear
where?
about it in middle school. It was like a whole unit or whatever. Like, don't leave your tampon in because this could happen. And we're like, oh, like it never could happen. And that was in middle school. And then in college, I'm telling my friends about it. They're like, no. And I'm like, yeah, like, could have been on the ground, could have been at my funeral, literally. Like,
So you literally went through this experience, went and saw 3 different doctors, had the experience of your first pap smear, and you have these conversations with your friends, and they're still like, nah, girl, that ain't happened.
I think because they're just not as forgetful as I am. So they're like, it can't happen to me. Like,
I think that's the thing. Honestly, I think we as growing up, as soon as we have sex, we ain't gonna get pregnant though. We ain't gonna catch an STD. We're not gonna have fertility issues. That's not gonna be me. And yet it is so many of us. I guess then, for those who don't believe they're as forgetful, what advice would you give to someone who doesn't believe this could happen? Or what would you wish you could have told your younger self?
I think to definitely slow down. I was a really big perfectionist. I now, like, after that, like, I started going to therapy too. I have anxiety, have depression, I have ADHD. All of that played a role into me forgetting the tampons. So I think, like, what was going on at the time too, of just like being super like a perfectionist on myself, that I wasn't even caring about my body. And now at 25, I care a lot more about my body because I need my body in order to do all the things that I want to do. So I think at 19, I definitely would just tell her to slow down, like, to really like care about live in the moment and care about what my body is doing, because that's what's bringing me to do all the cool stuff.
I love that. And I love that you listen to your body. And though you hate going to the doctor, like many of us, you chose to go and you continue to seek help because you knew something was wrong. And thankfully you found out what the damn problem was. Y'all, toxic shock syndrome exists. Amber, thank you so much for not only sharing your story, but just your smile and being here.
No problem.
And
thanks for having me.
Being willing to share the story because, again, I think so many people don't believe that this is happening to us, and yet it is, y'all. It is real.
It does.
So, Amber, where can people follow you, and where can they listen to you?
So I do have a podcast. I am a teacher, funny enough. I teach elementary school. Me and my friend have a podcast, the Educactivist Podcast, EDUCACTIVST, on Spotify and Apple Podcasts. So, yeah. If you want to, we talk about any issues happening in the education space as young teachers. So it's a cool place.
All right, guys, make sure you stay tuned. We have some stats and facts coming at you next about toxic shock syndrome. All right, y'all, back at it again with some stats and facts. Toxic shock syndrome is a rare, life-threatening complication of certain bacterial infections. Risk factors include recent surgery, open wounds, and, of course, like we found out, the use of super absorbent tampons, and one that may be left in there for just too long. Now, some of the symptoms that you may experience include a high fever, low blood pressure, vomiting, and a rash. Now, treatment includes antibiotics and possibly surgery, but listen, again, don't let your healthcare provider tell you just stressed. Can you get toxic shock syndrome after a tampon is removed? The answer to that is yes, it's possible, because TSS is actually caused by bacteria and not the tampons themselves. So one of the tips that we've always heard all of our times is to make sure that we are constantly rotating out our tampons if we must wear them. Now, I want to get back into the treatments because, like I said, there are medications. You may have to have a medical procedure. And normally the medical procedure will either be, like in the instance of our guest today, removing of the tampon, or also just the removal of unhealthy tissue. Now, again, you will need the critical care of a doctor here, and you could either go to an infectious disease doctor, your OBGYN, or your primary care provider. Again, any instance of a smell, some sort of irritation, excessive bleeding, in this case, the lack of energy or the lack of a food appetite, something is wrong. And again, it's always safer to know than to not to know. So please do not fear going to the doctor. I know sometimes we share these horror stories where we don't really trust our medical professionals. However, please please, 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 please go. If you would like to help me turn this podcast into an animated series, make sure y'all check out Period Sis, the animated series, over on our Kickstarter, as we are fundraising to be able to shoot our pilot episode. Anyways, guys, thank y'all and cannot wait to see y'all next week. Make sure y'all tune in wherever you listen to your favorite podcast, or watch the full episode over on YouTube. Search Period Sis. It's another tale of womanhood, y'all. Until next time, Period Sis.